Welcome to Friday's coverage of COVID-19. Korea has been tackling an alarming number of infections this week amid mounting calls for tougher social distancing measures. We have more on the local situation and that over in the US later on in our studio session. Up first, I have Kwon Swa with a broader coverage of the pandemic. So Korea is marking a third day of cases hovering above 1,000.
Yes, indeed, Sunny. It's the first time that Korea is seeing back-to-back figures at this level. It's 1,062 infections that we are seeing this Friday, which is a rise from yesterday. And which also goes for the number of domestically transmitted cases, which are also standing above 1,000. And with that, the country has recorded cases above 1,000 4 times in the past week since Sunday. And if we go back to last Friday, we were heading into the weekend at 689 cases. So we are seeing an on-week jump by around 370. And we also had many more COVID-19 tests conducted this week, which includes at temporary screening centers in the capital region. In fact, since Monday, in 4 days, 70,000 tests were conducted at such temporary screening centers, and through which 170 cases were detected. On Thursday alone, almost 33,000 tests were conducted at such test centers, and along with more than 51,000 tests elsewhere, that's a total of some 83,000 tests conducted in just a day. And those helped in detecting all of these cases across the nation. We have the capital Seoul at almost 400 infections in a day, although that is a decline from the record figure we had yesterday, and over 300 in Gyeonggi-do province, 65 in Incheon, more than 30 cases in many other parts of the country, also 44 in Gyeongsangnam-do province. Also, Jeju-do Island close to 30 infections in just a day, which is why the island has decided to close all schools and kindergartens between the 21st and 24th of this month. And with that, the total caseload here in the country stands at 47,515, and also the number of fatalities is going up. We have 11 added in the past day.
Right, so and given those alarming numbers, the big question, the big public question here is, when will Koreans be vaccinated? Do we have any word on that?
Well, Sunny, after an earlier purchase deal with AstraZeneca, according to an official at a briefing at the Health Ministry today, Korea will finalize a contract with Johnson & Johnson's Janssen as early as next week, and is likely to do the same with Pfizer by the end of this year, and also Moderna in January. Now, there's no fixed date on when citizens will start to receive the shots yet.
The first vaccines to arrive in Korea in the first quarter of next year, either in February or March, will be those from AstraZeneca. Locally produced vaccines by SK Bioscience are expected to roll out in February or March, and our vaccination campaign is being planned around that timetable.
And authorities also said that they are going to carefully monitor the vaccination program in other countries due to possible side effects.
I see. Meanwhile, on the international front, so our French President Emmanuel Macron has tested positive for COVID-19.
Right, Sunny. France, being one of the worst hit countries by the virus around the world, had its leader test positive on Thursday local time. President Macron will be under quarantine for 7 days, according to health protocols there. Other heads of states are on alert as well. Meanwhile, as President Macron had quite a number of encounters with them. In fact, almost all EU leaders during a meeting in Brussels last week, which has forced them also to go into self-isolation. Meanwhile, Macron's wife tested negative for COVID-19. And if you take a look at the numbers here, France now has over 2.4 million infections. The situation is getting worse in European countries as it has hit a grim milestone of 500,000 deaths in that continent alone. Also, the U.S. here at 17.6 million infections. Hospitalizations here are at a record high for the 12th straight day. And around the globe, we now have surpassed 75 million cases in total. And also, we are seeing daily deaths surpassing 10,000 on a daily basis. And those are the numbers I have for now. I'll be back on Monday. Back to you, Sunny.
All right, so thank you. Have a safe weekend.
You too.
Back on the local front, as we've been reporting over the past few days, treating COVID-19 patients is becoming a grave challenge in the absence of hospital beds. Now, for more on efforts to address this challenge, I have Kim Sung-hyun here in the studio. Welcome, Sung-hyun.
Good afternoon, Sunny.
Right, Sung-hyun, let's begin with the status of hospital beds then.
The situation is quite serious indeed. We have been seeing more seriously ill patients who have been forced to wait for hospital beds. Thus, securing more beds has become the government's top priority in recent days, since the rising number of patients in critical condition could lead to more deaths if they are not given the proper medical care. Now, as of yesterday, officials said there were 45 ICU beds left nationwide and only 4 in the capital area to serve its nearly 26 million population. Just 1 bed remains here in Seoul, 1 in Incheon and 2 in Gyeonggi-do province. As for Chungcheongbuk-do, Chungcheongnam-do and Jeollabuk-do provinces, ICU beds have completely run out. The shortage appears likely to continue for the time being as the country faces its worst crisis since the beginning of the pandemic. Now, on Wednesday, Senior Health Ministry official Yoon Tae-ho said at a press briefing that Korea has been working to secure 10,000 additional hospital beds for patients in the Seoul area, where the majority of recent cases have occurred, and includes 300 beds for the critically ill. On a related note, Suncheonyang University Bucheon Hospital has become Korea's first Tier 1 medical facility to operate a dedicated COVID-19 patient ward, providing some 80 beds. Prime Minister Chung Se-kyun said at a health ministry meeting that the government will exercise its full power and resources to ensure that COVID-19 patients do not have to wait more than a day to be assigned a hospital bed.
So, Sung-hyun, let me just clarify that. Some 300 ICU beds will be available in about a month then.
That's right. The government is laying out some detailed plans for the course of this month. The government announced that dozens of new ICU beds will be secured in phases over the next 3 weeks. Now, 70 new ICU beds will be secured from December 14th to the 20th. So that is Monday through Sunday this week. And another 130 are to be added the following week, and 87 during the last week of December, which adds up to nearly 300 new beds. However, Chu Young-soo, director of the National Medical Center's Planning and Coordination team, said the country was on track to add 10 critically ill cases on a daily basis in the Seoul area alone, and that the new beds are not sufficient in numbers to keep pace. In light of this, the government is working to secure more beds, not only at state-run medical facilities, but also reaching out to for-profit hospitals as well.
I see. Sung-hyun, I hear city officials here, that's Seoul authorities, are also looking beyond the medical arena to better accommodate COVID-19 patients.
Right, beyond the medical arena, city authorities have even been reaching out to universities. And the hope is to be able to use these campus accommodations to house patients with mild symptoms. Now, just yesterday, the city government asked Seoul National University to allow the use of its dormitories as community treatment centers, but SNU said it was difficult as some 4,600 students currently live on campus. SNU instead offered the use of its faculty meeting hall starting next week and are working closely with the city government in this regard. Acting Seoul Mayor Seo Jung-hyup said on Wednesday that the city was working to ensure that no patient is ever left behind. Let's take a listen.
The city government is doing its best to operate more community treatment centers in order to prevent unfortunate incidents where patients are forced to receive treatment at home due to the lack of beds in the public healthcare system.
The acting mayor added that the city plans to secure up to 1,900 beds and 22 treatment centers, expressing hope that more college dormitories could soon free up as students go on winter break. The University of Seoul has offered to set up some 500 beds in its dormitory, and 3 other universities are also looking to help out as well.
And aside from the academic arena, I hear places of worship are also offering to open their doors.
Yes, Sunny, we are seeing reports of several churches trying to do their part to offer part of their church space to be used for community treatment. Now, Somang Presbyterian Church, located near Apgujeong Station in Seoul, has offered itself to be used as a makeshift community treatment center. The church said it was providing enough space and beds for up to 280 patients. Seoul City is working in consultation with a number of other churches to see if if they can be used as treatment centers as well. Now, in the meantime, the military has also stepped in to assist the government in its COVID-19 response efforts by mobilizing all of its available resources. The Armed Forces General Hospital in the central city of Daejeon also started receiving COVID-19 patients on Wednesday to alleviate the nationwide shortage of hospital beds. Two other military hospitals in the southeastern city of Daegu and the northern city of Goyang are also ready to admit civilian patients in the very near future, according to the Defense Ministry.
That is reassuring to know. All right, Sung-yeon, thank you for that coverage.
Thank you for having me.
Right, face masks have become an indispensable part of our lives, but their disposal is fueling fresh environmental concerns. Well, a student here has come up with a way to better address this dilemma by offering them a new lease on life. Do take a look.
Hi, it's Shinsebyuk. According to a BBC report, globally, an estimated 130 billion face masks are disposed of every single month that we deal with COVID-19. What is more, tens of thousands of defective face masks are being thrown away at this moment. So how should we deal with such a huge amount of thrown away masks? And today we're going to meet a student who came up with a brilliant idea to solve the problem.
Since the pandemic, South Korea has seen a threefold increase in the number of face mask factories, and almost 400 to 500 million masks are being produced each month. He is Kim Han-il, a 23-year-old student majoring in living design at K-won University of Art and Design. What made him start making those chairs using disposed masks?
코로나 사태가 터지고 이 사태가 심각하다고 새삼 느꼈어요. 엄청난 양의 마스크가 폐기되고 있다고 생각했고 그 마스크가 재활용될 수는 없을까라는 의구심에서 여기까지 오게 되었어요. 저는 가구를 만드는 사람으로서 가장 많이 접했던 카테고리였고 가장 기본이 된다고 생각해서 의자를 먼저 만들게 되었어요.
Now these defective masks will turn into a fancy chair, and I'm going to try and make one with Han-il right next to me.
The first step you need to do to make a chair is getting rid of the mask strings.
이 필터가 폴리프로필렌이라는 플라스틱 소재예요. 거의 98%가 PP 소재이다 보니까 요거를 녹여서 붙여서 재활용을 하고 있습니다.
The next step is hot air treatment, where you melt the masks. Once it's cooled, it will make a chair. So what made him making chairs with defective masks discarded by factories?
마스크가 제조되는 과정에 10% 정도나 로스가 발생한다고 이야기를 듣게 되었고 버려진다는 의미가 상통한다고 생각을 해서 이제 조금 위생도 잡고 깨끗한 소재로 사용할 수 있지 않을까 해서 폐기되는 지금 마스크 원단을 사용하고 있습니다. 의자 하나당 대략 1,500장 정도 소요되는 것 같아요.
Tens of thousands of tons of face masks thrown away from factories became a wonderful art piece only with the idea of someone.
이 마스크 재활용된 소재가 의자가 되었다면은 어떤 조명이든 테이블이든 그 어떤 것도 만들어질 수 있다고 생각을 해요. 그래서 조금 더 이 소재를 재활용해서 시리즈화 시키는 게 저희 목표입니다.
Yeah, so these chairs are very well made, very strong. Compared to other ordinary ones, they are just perfect. I cannot really tell any difference. Well, wearing a face mask has become another daily norm. And with that, mounds of discarded masks have become another major environmental concern. And to deal with such issues, now we have to put our thoughts together to come up with better policies and measures. This has been 신세벽.
Right, it's time now for the final segment of our special coverage of Korea's free economic zones, and I have our Peter Bint here in the studio Welcome back, Peter.
Good afternoon, Sunny.
So over the past 4 weeks, Peter, we've covered the strategies of 7 free economic zones in the country. What are we poised to talk about today then?
Well, today we'll show the strengths of South Korea as a whole as an investment destination, especially in terms of the post-COVID-19 era, right? It is going to be the final part, and we'll touch upon the industrial strategy, how that's driven as well here. As a place to invest in, South Korea is a fantastic destination in terms of geographical advantages in its location, with easy access to the Asian market, a highly skilled workforce, and a convenient living environment. Located in the center of Northeast Asia, which is emerging as one of the world's top 3 economic regions, South Korea is a prime location for entering this burgeoning market.
Right, what other merits does the country hold?
Well, Korea is actually the first country in Asia to sign FTA agreements with the big 3, you could call them, the EU, the US and China. And having FTAs in place with more than 50 countries around the world, South Korea boasts an optimal business environment. And Korea's robust response in containing COVID-19 has been pretty cool as well.
Right, I was just going to say that actually. Peter, what is the country's action plan post-pandemic, that is, with regard to enhancing its business environment then?
Well, it's been seen as a very successful case, a good balance between keeping businesses going, but also keeping COVID-19 cases low, right, without shutting down the economy. And this has really provided stability to corporate investments and engendered trust among investors themselves. However, there are certain aspects of the free economic zones that need to be improved. It's not perfect. Compared to free economic zones in other countries, Korea does not offer corporate tax breaks that could greatly help businesses, while its incentive package is somewhat less robust. And there is the matter of state regulations, which need to be addressed, and the difference among regions in terms of development needs to be narrowed. Hence, the Korean government announced its Free Economic Zone 2.0 2030 and articulated the vision and strategy behind it in October of this year.
I see. Do tell us more about this ambitious initiative, Peter.
Yeah, so to develop these free economic zones more into global industry hubs that spur growth through innovation, it's necessary to replace the development-centered growth model of the past with an innovation-centric one and expand incentives to companies that invest in technology and specialized businesses. Laying the groundwork to implement regulatory reform is vital for attracting investments to new industries. An additional $55 billion will be spent over 10 years by the government, and the goal is to attract 4,000 tenant firms and create 200,000 jobs.
And those intentions come amid plans to foster new industries in the area, right, Peter?
Yes, that's right. So industries that have great technological impact and economic impact and can also support a network of related businesses will be selected as key specialized industries. Individual 5-year development plans for each free economic zone have been drafted. What are the key specialized industries in the 7 free economic zones? Well, why don't we watch this report to find out? It was in 2003 when the policy to form free economic zones was first introduced as a way to develop Korea into a hub in Northeast Asia.
The current development rate of the FEZ is 90%, which is much higher than the 60% in 2009. In recent several years, the number of companies, jobs, and sales volume increased more than 10% annually. There has been a lot of quantitative progress in the FEZ.
The IFEZ focuses on biotech and knowledge-based services. The BJ FEZ supports integrated logistics, advanced transportation modes, and machinery parts. The G FEZ fosters chemical materials and steel-related businesses. The GG FEZ nurtures electric vehicles and unmanned vehicles for ground, sea, and air. The DG FEZ assists information technology convergence and advanced medical care. The CB FES promotes biotech and transportation equipment parts, while the EFES cultivates tourism and advanced materials.
Now is the time to foster the qualitative growth by creating an ecosystem of innovation in key industries. By doing so, the government aims to develop the FES as the global basis of new industries that lead innovative growth.
Right, I see. So what benefits are in store for companies that invest in the free economic zones, Peter?
Well, relocation benefits for all domestic and foreign companies that invest in these key specialized industries, unlike before where only foreign invested companies were provided with them. The ratio of local investment subsidies and facility subsidies will be increased, and an additional 10% will be added on top of that. In addition, in order to foster a global high-tech industrial cluster, development costs will be reduced in addition to allowing each zone to select regulation exemptions as they see fit and apply them by ticking off items on a regulatory exemption checklist. Priority screening will also be given to regulatory-free zones.
Tell us a bit about the economic achievements thus far achieved at these zones, Peter.
Yeah, so there are now 6,000 tenant firms as of 2018, and their combined sales amount to an impressive $91.6 billion, and they have contributed to creating 170,000 jobs. This is a big boost to the country's economic growth. And when you look at just foreign investments, there are 340 foreign invested companies producing a profit of about $27.5 billion in sales, and they have added 40,000 jobs as a result.
It's quite impressive. Now, I hear, Peter, that 2 other cities have also been included in the list of free economic zones.
Yeah, in 2020, the cities of Ulsan and Gwangju were designated as free economic zones, and they're expected to spur new growth engines in the future. So let's find out more about the free economic zones underway in Ulsan and Gwangju as they're set to open in January 2021. Ulsan has been the center of Korea's shipbuilding business and automobile industry, in addition to being an energy hub in Northeast Asia. Leveraging the existing infrastructure of key industries such as automobiles, shipbuilding and petrochemicals, a new foundation for innovation industries will be established, and clusters for each industry will be formed to attract domestic and foreign investments.
울산 경제자유구역의 핵심 산업은 수소 산업입니다. 기존의 자동차, 조선, 석유화학 등 주력 산업과 연계하여 수소의 생산, 저장, 유통, 활용 등 전주기적으로 연계 산업을 육성하고자 합니다.
The Ulsan Free Economic Zone is comprised of 3 districts that include the Hydrogen Industry District, Electrogen Auto Valley, and R&D Business Valley. These districts will spur R&D, production and business support for the hydrogen industry. Gwangju City has designated the Bit Green Industrial Complex, Gwangju Energy Valley, Urban High-Tech Industrial Complex, and High-Tech District 3, which are state industrial complexes for advancing the fledgling eco-friendly automobile industry as free economic zones.
We expect free economic zones to stimulate economic growth in Gwangju. GRDP expected to increase by 12.3%, economic value added by 9%, and employment by 7.6% growth.
In the coming years, the Gwangju Free Economic Zone will foster future automobiles, smart energy, and AI as key industries. To achieve this goal, a total of 4 districts, including the Future Automobile Industrial District, Smart Energy Industrial District 1 and 2, and AI and Convergence District, will be formed to attract investments.
Right, so the Ulsan Free Economic Zone will focus on the hydrogen industry, while the Gwangju Free Economic Zone will foster the AI convergence.
That's right.
First then, what makes Ulsan an ideal place to invest in?
Well, Ulsan is the nation's top producer of hydrogen, and it already has an impressive 130-kilometre-long hydrogen pipeline and 10 hydrogen charging stations, which makes its hydrogen infrastructure the best that we have. The country also operates a demonstration centre for hydrogen fuel cells. Being a regulatory-free zone and research and development special zone, along with the presence of the Ulsan National Institute of Science and Technology, Ulsan has a strong ecosystem that can provide long-term support to the development of new technologies for the hydrogen industry.
Meanwhile, what does Gwangju have to offer?
Well, it's already got industrial complexes that are focused on future automobiles, smart energy, AI, and more under development. So the region has the potential to produce tangible results in a relatively short period of time due to these current developments. And in cooperation with KEPCO, the Gwangju Free Economic Zone has signed MOUs with 61 companies in the field of smart grids and energy efficiency for them to become tenants in District 1 and District 2 of the smart energy industry.
That is good to know. Now, Peter, it's been about a month, I think, since you started reporting on Korea's efforts to boost activity, economic activity within its free zones. What have been your thoughts while covering this topic?
Well, it's great to see the free economic zones not doing too badly during COVID times, and also getting really prepared for the future and what is to come. I must be honest, I hope there's more that are opened in the future, so you'll have me back to report on them.
It would be a pleasure to have you back in the show. It has been a pleasure having you with us.
Thank
you, Peter.
It's been a pleasure.
상황에 따라서는 3단계 격상도 신속하게 결단해야 하기 때문에 단계 부처와 지자체, 전문가들의 의견을 폭넓게 수렴하고 있습니다. 또한 국민의 호응과 참여 없이는 거리두기 자체가 공허한 조치인 만큼 사회적 공감대가 충분히 확보되어야 합니다.
The daily tally has been hovering above 1,000 for the third straight day. In today's due session, we further explore this reality and the efforts underway to address it. I have Professor Tak Sang-woo from Seoul National University here in the studio with me. Welcome back, Professor Tak.
Thank you for having me.
And I also have Professor Sarah Ok-shin from Korea University. Pleasure to have you back, Professor Shin.
Thank you for having me.
Professor Tak, despite the unprecedented numbers we have been seeing as of late, there are pundits who claim that the latest outbreak has yet to reach its peak, that the daily tallies are poised to even hit higher. Do you share this grim outlook?
Well, it is possible to see some of the increases in the number of newly confirmed cases. But I think we may be at the peak of what we call third wave or second wave of the COVID-19. But regardless, I think it's what's more important is that we are entering a long winter, and I think it's time for us to accept that it's not going to be a dramatic decrease we see unless there is a harsh but effective intervention measures in place.
I see. Professor Shin, the test positivity rate at the temporary testing centers that were set up in the metropolitan area back on Monday and started operations, that is on Monday, stood at 0.4%, around 0.4% on that first day. What does this figure imply? And what are your thoughts about these proactive efforts by the government to track the virus?
Well, these numbers are definitely higher than we expected. And this really means that, we have a lot more asymptomatic cases who are under the radar and might be silently spreading the disease in a community, right? And having these high numbers of asymptomatic spreaders are really big problems because these people can actually lead to hundreds of new silent infections. So doing these anonymous tests can definitely help us to detect more rapidly the people who are infected. And with more anonymous tests, more people who are infected will find. And that's okay. And this kind of proactive approach is necessary, and it will allow us to find more silent spreaders as much as possible.
Right. And staying with that, Professor Tak, more than 20% of all recent cases were reportedly untraceable. And some are now claiming Korea's tracing efforts are failing to keep pace with the escalating numbers of cases. What are your thoughts on this?
Well, I'm concerned that because those health centers that are directly responding to those new cases, they're asking their administrative staff to perform that contact tracing. But contact tracing is not an easy task. It's time-consuming and labor-intensive, and it requires certain technical acuity. And I think it's not too late for us to raise more troops of contact tracers before it's too late.
I see. Let's take a moment now to shift our focus beyond our boundaries. Authorities in the US began inoculating their people at the start of this week. And for more on that, I have Professor Bang Ji-hoon from the University of Michigan live on the line. Welcome, Professor Bang.
Hello.
Professor, I understand US regulators are poised to approve Moderna's COVID-19 vaccine for emergency use in the coming hours. Now, this follows approval by an influential FDA advisory panel. Please tell us a bit about the efficacy of this vaccine by Moderna.
Well, the study showed that it's very effective. It's like 95% effective. And that's kind of what the Pfizer vaccine does too. So the current mRNA vaccines we know are very effective in preventing COVID-19 disease. I guess what we don't know is whether it prevents spread of disease or not, but we'll hopefully have that answer soon also.
Professor, talking about efficacy, I hear at least 2 trays of Pfizer's vaccines in California needed to be replaced after their storage temperature dropped to about minus 80 degrees Celsius. Tell us more about this, please.
Yeah, that's the one potential issue with the Pfizer vaccine, that it needs really low temperatures and special equipment to transfer and store. And so we have the Pfizer vaccine in our institution, but a lot of hospitals across the U.S. do not have the Pfizer vaccine because they don't have the capacity to store this vaccine. And this incident basically told us that the concerns that we had about this vaccine, that it's difficult to store, it's difficult to transport, there's a lot of logistical issues, and if one step goes wrong, then potentially the vaccine can be rendered useless.
Right. Professor Bang, the first person to be vaccinated in the US was a New York City intensive care unit nurse. What are the priority groups for vaccination over in the US?
Yeah, so it's not only the U.S., I think across the globe, the number one priority group is frontline healthcare workers. And we prioritize these people because they're at the front lines, they're taking care of patients. If these people get sick, ultimately the patients suffer. And there's some data that when frontline workers get sick, they tend to get more sicker, potentially because they're exposed to so much virus. And so these are the first line. The healthcare workers are the first people that are getting vaccinated, and then the close second would be the patients that are at high risk of developing COVID-19 disease in a more severe fashion.
Would senior citizens follow them then?
Exactly. So the second line would be patients who are over 65 with multiple risk factors like hypertension, diabetes. These are the people who do develop severe COVID-19 disease. And so these would be the people following the healthcare workers that would get the vaccine.
Professor Shin, what is the WHO's recommendation with regard to priority groups for vaccination?
Yeah, so WHO has announced last week a roadmap for vaccination priority. And this scenario includes various scenarios depending on the, how many vaccines you have secured in your country. So if a population, if your population, 10% of your population has secured for vaccine, then the first target for the vaccination should be on-site medical staff. and then the elderly who have high mortality rate of COVID-19. And then if your population, about 11 to 20% of your population has secured vaccines, then you could include the elderly as well as people with complicated chronic disease and some essential personnel such as socioeconomically vulnerable groups can be included as a vaccine targets. And if you have more than 50% of the population have vaccines, then you could probably have essential personnel like police officers, teachers, people who have to work without social distancing. Those people can be all included in the vaccination programs.
I see. Meanwhile, Professor Pang, a healthcare worker in Alaska experienced a serious allergic reaction to the vaccine, marking the first such case, if I'm not wrong, in the US. Is this a cause for concern, in your opinion?
For now, no, because these severe allergic reactions, we call them an anaphylactic reactions, are known to happen with any vaccine that we give to patients. So it is important when we give these vaccines to patients to take a good history, make sure they don't have a history of developing these type of severe allergic reactions. And as long as you do it, I think for the most part, it is an avoidable reaction. So for now, I'm not too concerned, but we'll continue to monitor and make sure that these things don't happen. Yeah.
Right. All right, Professor Pang, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you so much.
Right, Professor Tak, Korea, for its part, is seeking to secure vaccines for 44 million people and to start its inoculation campaign sometime in early spring next year. How do you assess this action plan?
Well, the government has been saying that all along that they will make sure the vaccines we get is proven to be safe. And we need to remember that those vaccines that are approved only for emergency use, its safety result is not fully vetted. So even especially the long-term effect is unknown still. So I think what's more important is that until we reach the 70% of population get the immunity to COVID-19, we still need to maintain, practicing social distancing and, personal hygiene. And, vaccinating 70% of population is a big task. It takes Herculean effort to organize such a massive campaign. And, I think the question is not how soon we get the vaccine. The real question is how effectively and efficiently we are organized and prepared to deliver the vaccines to the people when they need them, when we get them.
Right. Professor Tak, experts have claimed that those with a long history of allergies should not seek to get the COVID-19 vaccines. What kind of allergies are we talking about?
Well, it depends. Some people develop different types of, immunization, impact, and when it requires a very technical assessment before they get vaccinated.
I see. So all this caution is understandable then.
Yes.
Professor Shin, the government is under mounting pressure to raise its social distancing alert level to level 3, but they have been cautious amid the possible economic repercussions. What options do you propose then in light of this scenario?
Well, yeah, this is very crucial period of time in terms of quarantine measures. I think the government has to go with very simultaneous strategies. So if, raising social distancing level to 3 is not possible or practical, then, the government has to secure, sufficient beds for COVID-19 treatment. So, having maybe college dormitory or indoor gyms to be open for COVID-19 treatment center will be very important. And at the same time, we have to continue with rapid and anonymous tests, diagnostic tests, so that we can find these silent spreaders as early as possible.
As a health professional yourself, Professor Shin, what are your thoughts on allowing members of the public to conduct tests by themselves at home, these home test kits, to see whether they are COVID-19 positive or negative?
Oh, you mean the
self-testing to be administered
kits
at homes that some lawmakers are talking about. What are your thoughts on those?
Right. Well, I mean, right now, you can go to any places for anonymous diagnostic tests. So if you can just go to the center in your region, then you can do that. But these self-diagnostic kits can sometimes give false results, false positive results. So you have to be careful about that.
I see. And Professor Tak, your university, as we mentioned earlier on the newscast, has offered its rooms for the staff members to be used as treatment centers for COVID-19 patients. What other efforts can be made, perhaps, to ensure greater supplies and staff members to deal with the pandemic? Because we're facing shortages in all fields, I understand, not only in supplies, but also workers.
Well, I think that the government is seeking more of a low-hanging fruit, but they should have been prepared for this kind of situation, and they were asked to find more shelters, more buildings to accommodate such needs. So I think organizing this kind of work without a much thought out, plan is has negative impact. So I think we need to be really careful when we pursue this route.
Professor Tak, earlier on you talked about boosting the numbers of people available to track COVID-19 patients, and Korea is mobilizing its military and law enforcement personnel to assist in tracing efforts. Right. What else can be done to effectively boost our capacity to trace patients?
Well, simple answer would be, we have more contact tracers in ready, but it's not going to be easy, and it's not really practical to find those contact tracers trained and educated in a very short time period. So, the alternative I could think of, I could suggest, is that every citizen become the contact tracer, and once you're found to be positive for COVID-19, and you become the contact tracer, you contact your family members, your friends, and your colleagues, and let them know of your situation and help prevent, infecting further to other people. And if you have certain suspicions, and if you feel like you were exposed to a certain infection, don't wait to see if you become sick. Just find one of those health centers and temporary screening centers and get tested. And I think that's most of us can do.
I would have to agree with you, Professor. Professor Shin, what are some ways of encouraging greater public compliance with social distancing measures, especially amid the growing sense of pandemic fatigue?
Well, yeah, I know that the holiday seasons are around the corner, and you want to celebrate with your family members, friends, and neighbors. But it's more important than ever to actively abide by the social distancing rules. And I think you have to minimize the activities, the daily routines, and human contacts as much as you can. Because we need really cooperation from everyone. And, at this time, if possible, please stay home. And we need to cancel all the unnecessary meetings. And we should keep in mind that doing these daily activities, like, having lunch with your coworkers or family members, can actually spread the virus and disease to others. So you have to follow the quarantine rules. And I think by doing that, you can protect yourself and the health of yourself, your loved ones and neighbors.
Right. Yeah. Professor Tak, given the shortages we have in supplies and staff members, some patients of COVID-19, especially those with mild symptoms, have been asked, or they are thinking of asking them to stay at home, to be treated at home via remote healthcare. What are your thoughts on this?
Well, most of us develop mild symptoms or no symptoms at all, and they will be, safe. But sometimes, in rare cases, those people might develop serious symptoms, and the healthcare system should be ready for those people. When we have too many cases, that's what we get. So we need to find more facilities to accommodate those potentially ill people, and we need to find more facility to accommodate those with mild symptoms and no symptoms at all. So, find more places and buildings are our top priority.
Essentially, it is our top priority.
Yeah.
All right, Professor Tak, as always, thank you very much for your thoughts. And
It's
Professor Shin, thank you for being with us today.
Right, well, that brings us to the end of this week's coverage of COVID-19. Do make an effort, as Professor Shin has said, to stay at home this weekend, as authorities believe we are facing a make or break moment with regard to the pandemic. Have a safe weekend. See you on Monday.
Korea announced its plan to secure vaccines for its citizens. According to the Ministry of Health and Welfare, the Korean government has secured vaccines for 44 million people through the COVAX facility and global vaccine manufacturers. A division dedicated to COVID immunization will be formed in order to ensure that the people of Korea are able to be vaccinated swiftly and safely. But the exact schedule for vaccination has yet to be decided.
다만 백신 개발이 아직 완료되지 않았고 안정성이나 효과에 대한 우려도 여전히 있는 만큼 예방접종 시기는